Have you ever pondered the power of diabetic drugs and their potential role in heart protection for non-diabetics? It might seem like a peculiar connection, but stick with me. Sometimes the most unexpected links can lead to the most significant discoveries. You see, the world of medicine is a bit like a detective story. Researchers are the detectives tirelessly searching for clues to unravel the mysteries of our bodies. And in a plot twist worthy of Agatha Christie, it turns out that diabetic drugs, specifically ones known as SGLT2 inhibitors like empagliflozin and metformin, could be our secret allies in the fight against heart disease. Now let's set the scene. Our story begins at the Icahn School of Medicine at Mount Sinai. Here, a team of dedicated researchers embarked on a clinical trial known as empatropism. They were investigating the effects of empagliflozin, a diabetic drug, on heart failure, a condition that can affect both diabetics and non-diabetics. And the results? Well, they were nothing short of astonishing. Patients treated with empagliflozin showed significant improvement, their hearts returning to near-normal conditions. The drug even improved exercise levels and reduced the risk of hospitalization. It's like the little engine that could, but instead of climbing mountains, it's reversing heart failure. But that's not all. The researchers discovered that empagliflozin also lessens and reverses adverse remodeling of the heart, improving its size, shape, and function. Imagine it like a home renovation show, but instead of flipping houses, we're refurbishing hearts. These findings are groundbreaking, suggesting that diabetic drugs could offer a new approach to treating heart disease, even in those without diabetes. It's as if we've stumbled upon a hidden superpower, lying dormant in the unlikeliest of heroes. So, if a diabetic drug can reverse heart failure, what other marvels could these drugs accomplish? Please click on the links in the description for a couple things our team recommends for maintaining a healthy heart. Now, let's talk about metformin, a drug typically used for diabetes, but showing promising signs of being a game changer for heart health. This is not just about managing sugar levels anymore. It's about embracing a comprehensive approach to cardiovascular care. Metformin, a medication that has been around for quite some time, might be the equivalent of that quiet, unassuming person at a party who turns out to be the life of the soiree once the music starts. A recent study published in eBiomedicine has shed light on the potential of this drug in a way that has caught the attention of the medical world. The study used a technique called Mendelian randomization to investigate the effects of disturbing 7 metformin targets on the heart health of non-diabetic individuals. What they found was intriguing. These targets, when perturbed, were associated with beneficial effects on blood pressure and body mass index in non-diabetic people. Imagine that. A drug initially designed to help manage diabetes could potentially aid in maintaining a healthy heart, especially in those not suffering from diabetes. And there's more. The study also indicated that perturbing metformin targets reduced the risk of coronary artery disease and type 2 diabetes in the general population. Now, this doesn't mean we should all rush out and start popping metformin pills. The study does have its limitations, and further research is needed to confirm these findings and determine the best dosage and duration of metformin use in non-diabetic individuals. However, it does make one wonder about the potential of this drug. Could metformin be the unsung hero in the fight against heart disease? Could it be the secret weapon in promoting heart health awareness and maintaining a healthy heart? Only time and more research will tell. For now, though, it's safe to say that metformin has certainly earned its place in the spotlight, and we're excited to see where this journey takes us. What if I told you that diabetic drugs could serve a dual purpose in our bodies? Yes, you heard it right. It sounds like something out of a science fiction movie, but it's actually grounded in the reality of our modern medicine. The spotlight is on diabetic drugs, specifically SGLT2 inhibitors like empagliflozin and metformin. These aren't your run-of-the-mill medications. They're showing immense promise in both managing diabetes and safeguarding our hearts. Let's take a peek into a study from the BMJ. This study threw light on rosiglitazone, a drug used to treat type 2 diabetes. But wait, there's a plot twist. The drug was associated with an increased risk of heart problems, particularly heart failure. It's like finding out your favorite superhero has a dark side. However, it's not all doom and gloom. The study also provided us with valuable insights, leading us to a path of discovery and understanding. It emphasized the importance of access to raw clinical trial data, known as individual patient-level data, IPD, in accurately assessing the safety of drugs. It's like having a backstage pass to a concert, giving us a clear, unfiltered view of the situation. Now, let's shift our focus to empagliflozin and metformin. These two are like the dynamic duo of diabetic drugs. Empagliflozin, for instance, has shown effectiveness in treating and even reversing heart failure. Imagine a drug that not only helps manage your diabetes, but also moonlights as a heart protector. Metformin, on the other hand, is looking like a potential game-changer for heart health in non-diabetics. It's like finding out your handy Swiss Army knife has an extra tool you didn't know about. The dual benefits of these medications underscore their significance in comprehensive cardiovascular care. They're like the multi-talented artist who can sing, dance, and act, providing multiple benefits from a single source. Imagine the possibilities if we could harness the power of these drugs for heart health. They could be the key to unlocking a healthier future for us all. Stay tuned as we delve deeper into the future potential of these wonder drugs in the next scene. So, where does this leave us in terms of the future of diabetic drugs in heart protection? In the realm of medical research, there's a promising horizon where diabetic drugs are being recognized not just for their role in managing diabetes, but also for their potential in heart protection. It's like discovering that your favorite mystery novel also doubles as a guide to gourmet cooking. Who would have thought, right? Now let's talk about a clinical trial conducted by the Icahn School of Medicine at Mount Sinai. They found that empagliflozin, a diabetes drug, can effectively treat and even reverse heart failure in both diabetic and non-diabetic patients. It's as if the drug took on the role of a heart personal trainer, helping to improve the size, shape, and function of the heart, leading to better exercise capacity and quality of life for heart failure patients. And the cherry on top? It also reduced the risk of hospitalization. These results are so promising that researchers are hopeful for FDA approval of empagliflozin for heart failure patients in the near future. But there's more to this story. Let's introduce Jardiance, a sodium glucose co-transporter drug. It's like that multi-talented friend who seems to be good at everything. Not only does Jardiance lower blood sugar levels in patients with type 2 diabetes, it also reduces the risk of cardiovascular death by 38% and overall death by 32%. Imagine that, a diabetic drug acting as a lifeguard for the heart. Jardiance can also decrease hospitalization for heart failure by 25% and reduce the risk of kidney disease. Now, while we marvel at these medical advancements, it's important to remember that research is ongoing and more studies are needed to confirm these findings. But the potential is undeniable. Could we be on the brink of a medical revolution where diabetic drugs become a common preventative measure for heart disease? Now, let's circle back to our initial question. Can diabetic drugs add a layer of protection to the heart in non-diabetic individuals? We've journeyed through the world of diabetic medications like empagliflozin and metformin, and their potential benefits for heart health. These drugs, traditionally used to manage diabetes, have shown promising signs in the fight against heart disease. Think of it like this. Imagine if your umbrella could not only shield you from the rain, but also cool you down on a hot day. That's the kind of dual functionality we're talking about with these diabetic drugs. They're designed to manage blood sugar levels, but research suggests they might also offer a protective umbrella for the heart, shielding it from the storm of cardiovascular diseases. However, it's important to remember that while these findings are exciting, they're also just the first steps. More research is needed to fully understand these potential benefits and how they can be best utilized. It's a bit like being at the starting line of a marathon. The road ahead is long, but the potential rewards are significant. So, what do you think? Could diabetic drugs hold the key to heart protection for non-diabetics? Could these medications be the superheroes we need in the fight against heart disease? Or are they more like sidekicks, offering support but not quite ready to take the lead? We'd love to hear your thoughts, so please drop us a line in the comments. And if you found this video helpful and informative, don't forget to give it a thumbs up and subscribe to our channel. For more information on maintaining a healthy heart, be sure to click on the links in the description. They lead to some resources our team recommends for keeping your heart in tip-top shape. As always, thank you for watching, and here's to your health.